Are you a pitcher that feels like they don't have enough mobility in their mid-back to get their arm into layback sufficiently, or do you just feel really stiff along your mid-back and it's affecting your mechanics? I want to go over today exercise that we use to improve thoracic spine rotation mobility, which is one of, if not the most important mobility requirements that pitchers need, not only from a performance standpoint, but from maintaining proper mechanics. My name is Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey. I have helped countless baseball players, primarily pitchers, get back to throwing pain-free and get stronger so they can excel at a high level on the field. So again, what we're going to go over today are exercises specifically focused on thoracic spine rotation. So your thoracic spine is the middle part. We have your spine going all the way down from your neck all the way down to your low back. Your thoracic spine is really that middle part of your back more than anything. And as a pitcher, you need significant amounts of extension, which is straightening here, not just opening the chest up, but actually extending at the spine, and then rotation. So getting that rotation at that upper back. A lot of times what happens is guys are limited in both of those movements, and as a result, when you're limited in thoracic spine rotation, the typical compensations that we're going to see are guys are not able to efficiently get into layback enough. You need a certain amount of extension and rotation to get into layback, not only here, but just really when you're getting your arm cocked to that position. Then the other side of it is guys will end up getting a lot of their rotation through their lower back. And the lower back is really not meant to withstand the rotational stress of throwing, especially pitching. So that's why we really want to work on rotation there more than anything, all right? So first thing we're going to do, I'm going to start, you're going to use a wall for this. For those that are really stiff, you want to start farther away from the wall. The wall is more of a cue for you versus a task, okay? So I'm going to start with my inside leg down. And the reason I like to do it in this position is because it's going to work on that hip-shoulder separation. So your ability for your hips to stay forward and closed while you hold your trunk back to get your arm just like that front foot strike, all right? So you're going to be in this position here. Hands are going to be behind your head like this. Arms are nice and relaxed. A lot of times guys will do this, and they'll just compensate with their shoulder blades more than anything. So I want to have nice and relaxed arms here. So I'm going to be right here. I'm going to go up and over and turn. Again, I'm just using my back. If I would use my shoulder, see how much further I can get? So again, we want to just go with our back here, and then we're turning around this way. So again, up and over, turn, and back this way, all right? So that's the first one. Again, that's going to be tough for guys that have tight hips, especially tight mid-back, thoracic spine areas. So don't necessarily force that. Just start further away from the wall, and don't worry about trying to get as aggressive with that movement as possible, all right? So the next one is going to be, you're going to be in we call it an adductor rock back. So we're getting some groin hip mobility with some thoracic mobility as well. So what that's going to look like, you're going to have one knee down on the ground here. Your other foot's out to the side here. You are going to rock back like so. So you should feel, as you rock back, more of an intense stretch throughout that groin, maybe even the hamstring a little bit, okay? If you don't feel it enough, you can turn that foot up. That'll get that hamstring groin a little bit more. But for right now, we're going to be rocked back like so. You are going to reach through. So with my outside hand, I'm reaching towards my leg that is extended out to the side. I'm reaching through, and then I am reaching up towards the ceiling, rotating. Again, I'm not just here doing this. I'm rotating with that spine. Coming down, rotating up. Coming down, and rotating up. All right? So those are two of my go-to exercises for pitchers that are limited in that thoracic spine rotation, extension, mobility. So we want to just try to get that as normalized as possible because, again, that's not only going to have an impact on arm health and positioning, but mechanics as well. And if we don't have the mobility in those positions, our mechanics are going to be negatively affected. When mechanics are negatively affected, unfortunately, that ends up putting more stress on the arm, specifically the shoulder and elbow. So if you're a baseball player or a pitcher and you're currently looking to improve your mobility throughout your spine, you're not sure where to start, or you're rehabbing any injuries, go ahead and leave a comment below with any questions you have. You can like and subscribe to our channel. We put out a lot of content specific to baseball players, or you can check out some of our free resources below.